Hi, my name is Jonathan Tinkham. This video is for the RN to BSN program at Winston-Salem State University. In this video we're going to be doing a complete neurological assessment, including height, weight, vital signs, health history of our patient who, for the purpose of this video, is not my wife, but we will rather call her Mrs. T. Before we meet Mrs. T, I just want to point out our exam room just consists of our 2 chairs. That's all that we will need for this neurological exam and vital signs. For the purposes of the video, I've just washed my hands, and if I was in an actual clinical setting, I would don my gloves at this time. Mrs. T, if you could come on in. Good to see you, Mrs. T.
Nice to see you.
You can have a seat. Mrs. T has consented to have her assessment and health history videotaped for the purpose of this class. Mrs. T, if you could just verify that for the camera.
I do. I consent.
All right. Mrs. T has a health history, including a fractured nose at age 16. She had a rhinoplasty after that incident. She hasn't had any issues since that procedure. She had a cesarean section in 2008 and also in 2011. She had a miscarriage with a D&C in 2010. She also has a history of gastroesophageal reflux disease. At one time she was put on omeprazole. She does not take that anymore. Mrs. T doesn't have any current problems with her GERD. She doesn't take any medications at this time. Is that right, Mrs. T?
Yes.
Okay. We're going to go ahead and go forth with our height and weight. If it's not visible to the camera, there's a scale back here. Mrs. T is wearing no shoes. She doesn't have her purse, anything bulky. Her weight is 105.6 pounds. I'm going to have Mrs. T stand flat-footed and straight. They're back against this wall that I've pre-marked. Okay. Mrs. T's height is exactly 5 foot 1 inch. Okay. We're going to proceed with vital signs for Mrs. T. I'm going to have her pop this thermometer under her tongue to get an oral temperature. While we're waiting on that, I'm going to go ahead and get a radial pulse rate and respiratory rate. Okay. Mrs. T's heart rate is 64 beats per minute. That's 16 beats over 15 seconds times 4 to achieve that rate of 64 beats per minute. Her respiratory rate is 20 respirations per minute. That is 5 respirations over 15 seconds times 4 for a respiratory rate of 20 respirations per minute. Mrs. T's temperature is 98.4 degrees oral. I'm going to go ahead and get a blood pressure reading. Okay, Mrs. T's blood pressure is 104 over 64. That's a normal, healthy blood pressure for someone of her size and age, which is 32 years old. All right, so everything up to this point has been healthy, height, weight, vital signs. I'm going to jump into Mrs. T's neurological assessment. I'm going to start off, as always, with orientation questions addressing person, place, time, and situation. Mrs. T, if you could tell me your whole name.
Amanda Tinkham.
Okay. And what month and year are we in?
July 2016.
Okay. And where are we currently?
In our home.
Okay. And for the purposes of assessing situation, I'm just going to ask Mrs. T why we are videotaping this.
For your BSN program.
Okay. For my BSN program. Okay, so Mrs. T's answers to all orientation questions are correct. I'm going to ask her if she's experiencing any new, unusual symptoms relating to neurological issues. Are you having any numbness, tingling, weakness, fatigue, either generalized or in any extremity, anywhere in your body?
No.
Okay. All right. Mrs. T seems to have no new symptoms. We're going to jump into her cranial nerve assessment, cranial nerves 1 through 12. We're going to start with her olfactory nerve, which controls your sense of smell. I'm going to ask that Mrs. T close her eyes. And I'm going to ask that Mrs. T identify the smell that I placed before her. Mrs. T, what are you smelling?
Alcohol.
Mrs. T has correctly identified the alcohol swab as the source of the smell. Next, we're going to go to the optic nerve, which controls our vision, cranial nerve number 2. To assess vision, we would use my homemade Snellen eye chart here. For the purposes of time, I'm not going to ask that Mrs. T read this, but normally we would read it with each eye individually and both eyes together to assess vision. Next, we're going to move on to a few nerves at once. We're going to talk about the oculomotor, trigeminal, trochlear, or actually trochlear and then trigeminal, and abducens nerves. All of these nerves have to do with movement and sensation of the eyes and facial muscles. First, we're going to assess the pupils of Mrs. T's eyes and how they constrict when reacting to light. I'm going to ask that Mrs. T look straight at me. I'm going to come in from the outside with my light. As I shine the light, Mrs. T's pupils constrict equally and then expand after the light is taken away. From the other side, the same reaction. Both pupils constrict equally and then expand when the light is taken away. I'm now going to observe Mrs. T's eye movements. I'm going to ask that she track my pen. As I move it, track my pen. As I move it from one quadrant to the other, I'm observing for nystagmus. I'm going to ask Mrs. T about diplopia, blurred vision. Mrs. T, are you experiencing any blurred vision, double vision, anything other than a clear pen moving around?
No.
Okay. So Mrs. T's eye movements look great. I'm going to look at her peripheral vision. To do this, I'm going to ask her to look straight at me, not at my hands. I'm going to put my hands in the air. I'm going to ask her which hand I'm moving.
Your right hand.
Okay, right hand is correct. I'm going to put them down. I'm going to ask her which hand I'm moving.
Your left hand.
Okay, Mrs. T has been able to correctly identify which hand I'm moving with her peripheral vision, and that's great. Next, I'm going to ask that Mrs. T close her eyes. I'm going to assess the sensation in her face. I'm going to touch her with an object. I'm going to ask her if it is a soft or a sharp object.
Soft.
Okay, Mrs. T has correctly identified the sensation of a soft touch of the Q-tip. I'm going to ask her to keep her eyes closed. I'm now going to touch her face with a different object. Can you tell me if that is sharp or soft?
Sharp.
Okay, she's correctly identified my tweezers as a more sharp sensation, and that's accurate. Next, I'm going to take a look at Mrs. T's facial nerve. This controls more of the movements of the muscles around the face, especially including around the eyes and forehead. I'm going to ask that Mrs. T raise her brows and wrinkle her forehead. Her eyebrows do raise equally, her forehead wrinkles. I'm going to put my thumbs on her eyebrows and ask that she scrunch down. I can feel the muscles of her brow moving down strongly and equally. No issues there as well. I'm now going to assess her acoustic nerve, which controls her sense of hearing. To do this, I'm going to show a number to the camera. I'm going to whisper it softly into one ear only. Okay, Mrs. T has correctly identified that whispered number. Again, I'm going to whisper into one ear only.
1.
Okay, so Mrs. T has correctly identified the numbers that I've whispered into her ear at just a soft whisper. Next, we're going to go into another group of nerves. 9, 10, and 12 are the glossopharyngeal, the vagus, and the hypoglossal nerve. All of these nerves have to do with the mouth, tongue, our ability to swallow. We're going to conduct a few tests to assess the normal function of these nerves. I'm going to ask that Mrs. T take a sip of water. I'm going to be assessing that she can swallow this water. She doesn't have to cough, clear her throat, or anything of that nature. Can you tell me your name?
Amanda.
Okay, Mrs. T's speech is normal after taking a swallow. That's all great. I'm going to ask that Mrs. T smile. Her smile is nice and symmetrical. Can you stick your tongue out at me? Her tongue is midline, no issues. Can you open your mouth and say ah?
Ah.
Okay. Everything seems to be intact with Mrs. T's mouth movements as well as tongue. The last thing I'm going to assess is cranial nerve 11, which is the accessory muscle, or accessory nerve, I'm sorry. This controls shoulder and neck movements. I'm going to have to ask Mrs. T to shrug against my hands. They feel strong and symmetrical. Turn against my hand and the other way. Okay. All of those muscles feel strong and symmetrical. So this completes the cranial nerve assessments. I would go on then to assess Mrs. T's strength in her extremities, her grips. Give me a big strong squeeze. Those grips are strong and equal. I would go on to assess push and pull. I know that we're running short on time. Push and pull of arms and legs as well as arm drift. All of the findings so far in Mrs. T are normal neurological findings. She seems to be a healthy young lady. And I hope that you've enjoyed this video, and I hope that you have a great day.